Are you a current or future physician assistant wanting to learn more about finances? Then join me on this journey to become a PA the FI way. Hi, my name is Kat, and I'm a practicing certified physician assistant who will be your host. It took me 5 years after I started practicing medicine as a PA to thoroughly dive into my personal finances after I discovered the concept of financial independence. I want to use what I have learned to help you avoid some of the financial mistakes that I have made while sharing some of the financial wins that I have had along the way. Join me as we discuss financial strategies to guide you to becoming a physician assistant on the way to financial independence. Welcome back, everyone, to the PA the FI Way podcast. I'm your host, Kat, and I'm really excited to have a very special guest. We have Chris on the show today, and Chris is going to share all about malpractice for PAs. And this is a topic that can, on the surface, seem a little confusing. So Chris is definitely the expert, and he's going to share lots of information today. Welcome to the show, Chris. So excited to have you today.
Thank you so much for having me. I appreciate the opportunity.
Yeah. Let's get started with sharing a little bit more about your background, both as a human, but also as a PA.
Yeah, no problem. So my name's Dr. Christopher Cannell. I've been a PA for 22 plus years. I've been practicing in orthopedic surgery, and then mostly the majority of my career has been in emergency medicine the last 20 plus years. I wear multiple hats. I'm credentialed for emergency medicine, orthopedics, and hospital medicine in my healthcare system. I just recently going to be making a transition where I'm going to be going down to part-time clinical work, and I took a full-time position at the Doctor of Medical Science program at University of Lynchburg, where I graduated from in 2022.
Very cool. You have practiced in many areas of medicine and then even over 2 decades as a PA. What prompted you to go back and get your doctorate a few years ago?
Yeah, so I've been raising my hand all throughout my career, getting involved in leadership, operations, and getting involved in all different types of initiatives, onboarding, training, project management. And I just have always wanted to further my education and sort of did a lot of leadership and training work, got my CAQ in emergency medicine. I'd always sort of said, what's going to be my ticket? Like, how will I get a seat at the table? How will I reinforce this restlessness that I have inside me to sort of quote unquote break that glass ceiling? And I think it's always tough for us as PAs to sort of do that. And I think I felt like the education and training from the doctorate program really allowed me to do that, and it's really allowed me to give me the confidence and sort of that ability to sort of write that ticket to have success in these spaces. So I pursued it in 2001. I don't know how I possibly worked full time, had 3 kids with a wife who works in hospitalist medicine, and did the program in 1 year full time. So not a part of my life I want to go back to again, how stressful it was, but I'm very glad I pursued it and very glad I got it. And I felt like ever since I've gotten my doctorate degree, I've really been going on hyperdrive with my career.
That's great. With PAs, they certainly have that option. And like you said, if you feel like you're wanting more opportunities at different tables or leadership roles or things like that, it can be a really great fit for a lot of people. And there are lots of doctor programs out there with different focuses too.
Absolutely. There's so many options for people. And I think if you're interested in pursuing that path, look what the options are and see what fits your needs.
Yeah. And I'm curious, with talking about malpractice today and your business, the APC consultant, what sparked your interest in medical legal work back when this started for you?
Yeah. So what sparked my interest was, I think really the data really points towards, we're all have especially with high risk areas that you practice in, we're all susceptible to the possibility of getting into a malpractice suit. And unfortunately, I got sued. And it was a wake-up call to me. You go through all the series of emotions, but thankfully I came out on top in the case, and I did win. And that sort of opened my eyes to sort of how I need to practice, how I need to support my colleagues in practice. What is the practice environment around me? And how do I mitigate that risk as much as possible? I'm not sure how much I was interested in pursuing work in this area until I was approached by the malpractice firm that represented me in my case to serve as an expert witness for them for several cases. And the more and more, just because they felt like I was such a great witness, that I was professional, I was articulate, I was well spoken, I was well prepared. And the more and more I got involved with the work, I realized, hey, this is great work. This really complements me as a clinician. And it really is a flexible environment that I can work from home. And I said, this is great work. I should look into this and try to do it more. And over the last years, I really have exploded the work in this space.
It's such a great part of your story where you had this down part in your life, but ultimately it was a lot of stress and things turned out well for you. And throughout that whole process, you must have, again, been professional and have still represented yourself really well so that they saw that in you and saw that this could be a good opportunity for you. And you decided to make a side career out of this too, in addition to your PA works. For a lot of people, that could be a really hard time in their life. And it sounds like that good things happened from it for you.
Thankfully, I think every opportunity in life is an opportunity to grow. And it really gave me perspective. And I'm glad that I sort of prepared for the case and performed in the case the way that I did, because it created an opportunity for me. And honestly, it changed my life, both from a professional standpoint, but also from a side hustle, and now even greater than a side hustle.
Yeah, absolutely. And I'm excited to talk a little bit more about risk management or different strategies that we can do a little bit later in the show. But first, before we dive into medical malpractice insurance further, why do you feel as though PAs and clinicians are just so undereducated about malpractice and legal risk? I feel like it's maybe slightly touched on in PA programs. Maybe it is more so nowadays, since I graduated from PA school a little over 11 years ago. So maybe PA programs nowadays are a little bit better about it. But I feel like I was barely taught about it. And even, in my first few roles as a PA, no one in leadership really teaches you about it either. And it's almost like you need to learn this information for yourself.
Yeah. I mean, looking at the blueprint for the pants, it's 6% of the test, right? And even that's just professional practice. That's not even malpractice, sure. Right? So it's a much smaller piece of it. And, I know when I went to PA school, we didn't touch on this at all. And I think this is just one of many areas that are lacking in PA education, coding, the business of medicine, contract. There's so many different areas that we're lacking. And I realize there's only so much time in PA school. It's really important that we understand and learn the medicine and rotations. I think this is an essential part of practicing. It's part of the business of medicine. Why is it? I don't know, other than the fact that it's just the structure of the education. And it's not just us, right? It's all medical specialties. It's physicians, it's CRNAs, it's nurse practitioners, it's pharmacists, whoever it may be. It's lacking in all areas. So this is part of the business of medicine. We need to spend way more time discussing this, preparing PAs to hit the ground running. And this is why I find this work so important, because we spend so much time on our education and training, so much financial commitment to it. We need to protect that risk. We need to protect so we can have career longevity and we can have wellness, and be there and present for our families. And we can't let this affect us. So I think we need to spend way more time on this in school.
Absolutely. And let's dive into malpractice insurance 101 so that the listeners can really better identify and understand what their malpractice looks like, what options there are for them, what some of the words actually mean when they're trying to decipher the information. Like you touched on, it is really important. In this show, I talk about building your wealth with paying off debt and investing. But if you're not protecting your wealth with important types of insurance, then unfortunately it can be wiped out, or at least a drastic cut to it too. So no one likes insurance. I get that. No one likes to spend their money on insurance, but there are absolutely certain types of insurance that are really important to have, and malpractice insurance is one of them. But I'm curious to hear from you, Chris. What is malpractice insurance actually protecting PAs from?
Yeah. So think of malpractice insurance like any other insurance that you have. It's catastrophic coverage, right? So it pays for the attorney to guard your professional and way of life. It is the protection of your assets, your reputation, like we spoken earlier, career longevity. It's just like any other insurance. But you gotta protect yourself. You have to protect. You are your own enterprise. You are your own ability to support your family. I'm at a PEA school at 25 years old. I had a long career ahead of me. I still have a long career ahead of me. It's really important that we continue to protect that and understand what that means, what that looks like, because none of us want to appear on the National Provider Database and have it affect our careers moving forward. So it is absolutely essential to all medical professionals, not just PAs in practice, to understand malpractice insurance and how it protects you and why it's important.
Yeah, a good way of thinking about it is, again, not only practicing your current assets and current wealth, but future income and future wealth building too with your career as a PA.
Correct.
What are some actual consequences of not having good liability insurance in place? A lot of people have insurance in place, but again, they don't necessarily know if it actually is a good policy, or it might not protect them as well as they thought to. So what are some consequences that you've seen over the years?
Yeah, so the consequences can be catastrophic, right? I mean, you have to understand like what your policy covers. Like, is it, as you as an individual from, what it covers for you, like 1 million and 3 million is a typical policy you might see. And then you have like the aggregate that might be like, 3 to 5 million or 5 to 7 million or even 10 million, 20 million. It all depends on sort of what the umbrella policy is. But there, you may see all the time in the news, it all depends on sort of what comes across your email. But there are some very high nuclear verdicts that occur out there, and you're going to see those more in certain states that have no limits on non-economic damages. And so you have to protect yourself, because everything that you've worked towards, everything that you've built, if you're not properly protected, it can all go away. And that's why it's important to have appropriate discussions with all the appropriate experts. In general, insurance will cover your defense, your attorney fees. It will cover expert witnesses, which are really key to a malpractice suit. If I were to tell you who's the most important factors in a malpractice suit, it is the expert witnesses. It'll cover all the costs. If you're board representation, all of it will be covered. I think we can sort of talk a little bit more detail about what that looks like, in certain situations. But just in a nutshell, it covers you from catastrophic results.
Yeah, that's great advice for sure. And just to further break it down so that the listeners are on the same page, there might be new grads or even PA students listening to this episode. When you say 1 million, 3 million for policy limits, what in the world does that mean, Chris?
Yeah, so 1 million and 3 million would be basically for like damages that might occur in your situation. So that's like an individual, case. So say you are involved in a malpractice case, in order to pay for your legal fees, the overall majority of the time we are covered under some sort of umbrella policy or group practice policy. And, we can talk a little bit about individual policies as well, but you will see oftentimes a lot of those policies will have that individual component. So we'll cover that sort of, depends on how you look at it, but basically can cover those damages that can occur or the legal fees that are associated with it.
1 million versus the 3 million in that. So 1 million in a year, correct, for a certain claim. Is that right? And then 3 million
correct
would be if you have more than one claim within that year.
Yeah, sorry. Yes, that is
Okay.
correct. It helps to provide that appropriate coverage in that regard.
Yeah. Okay. And like you said, some PAs just have no idea really what they're covered for, because it can be through their employer as a benefit, or sometimes if they're independent contractors or maybe benefits are provided in their role, then they might have to obtain their own malpractice. But I would say most PAs that I've come across do have employer provided malpractice. And again, like me as a new grad, I used to think, oh, I'm good. They have it covered. I believe they have a good policy. I don't know what's in there, but I know I'm covered under this malpractice policy. So what do you see that clinicians are wrongly assuming when their employer tells them that they have malpractice that they're covering for them?
So you have to remember that when you're being covered by a policy, who is the policy? Who's paying for the policy? It's not you, it's your employer. And so they are going to cover who pays for the policy, right? They're going to cover you because you're covered under the umbrella. Although by vicarious liability, vicariously, they're going to represent you because you're being covered under that umbrella policy. So, but they don't necessarily have your self-interest in mind. They have the self-interest of the institution, of the healthcare system in mind. So that's why it can get a little sticky, because what represents you professionally, because you are an agent of the agency. So you are the provider of the healthcare institution, so agent and agency, and they need to cover you for that. Know that they're, at the end of the day, they're the one that pay for the policy, and they're focusing on what's important for them for their self-interest. And so that's where it can sometimes get a little sticky, and that's why sometimes it can be very important to consider having your own malpractice policy, because you will have your own ability to be represented by your own attorney, by your own malpractice carrier who have your sole interest in mind. And, they can work together for that coverage. But it's always important to just keep that in the back of your mind when you come to a case. But I will tell you that when I had my suit, whenever I deal with cases, which I've done, many, many cases, I think close to 60 now cases I've reviewed, that the law firm that represented me really just gave me so much attention. They were so professional. They were so helpful. And there was no sense that they weren't representing me. There was no sense that they did not have my self-interest in mind, but just know that intricate detail.
Okay.
So that's why, it's always important to consider having your own malpractice policy.
Okay. So to clarify, with your case, you did not necessarily have your own malpractice policy in place, but you're saying that many times it's not a bad thing to also add on to your employer-provided malpractice policy?
Yeah. So you want to think about like what that policy is. Is it a claims made policy? Is it an occurrence policy? Do you need tail coverage? We can sort of talk a little bit more detail about what all these mean,
sure.
or nose coverage. But so at the time, no, I did not have additional insurance. I will tell you that the employer that I work for has tremendous coverage, and one of the main carriers across the country. And I felt pretty confident in what they were able to provide. But there may be situations where you might work for a smaller entity or one that doesn't have a great policy, and you might want to sort of think about your employment situation, what that looks like by looking at your own face sheet, and sort of, and also you have to think about like what is your situation? Are you not well supported? Are you well supported? Is there a lot of risk where you're at?
Sure.
So I think everybody's situation's different. And you have to think about sort of what that looks like for you. Are you a 1099 contractor? Are you a W-2 employee? There's so many different ways to look at this. Are you a W-2 employee that works for a private entity that staffs a hospital? So it gets into like these finer granular details that everybody's situation's different. And so you have to look at it, differently for everyone.
Sure.
So.
That makes sense for sure. And speaking of 1099 for independent contractors, that is what I currently am. I've been W-2 for several years. In the past few years, have switched over to independent contractor. And the clinic I contract through, they don't provide any benefits whatsoever. So malpractice is something that I get myself for as a business expense and as malpractice insurance for covering myself. But there are some independent contractors out there that I've seen that is a provided benefit for them. So could you share a little bit what are some of the nuances you see with 1099 independent contractors versus W-2 employees in regard to malpractice overall?
Yeah. So I'm glad that you brought this up. So I actually have, I wear multiple different hats. I'm also a 1099 contractor working for a locums tenens company, and they provide a claims made policy for me. So I don't actually have to buy my own separate malpractice, but I've considered it it is a large locums tenens employer.
Sure.
And felt like the coverage was pretty adequate. And so everybody's situation is different, but ultimately as you're performing as an independent contractor, it's really called, again, we talk about agency, an ostensible agency, and what that sort of looks like. But you have to sort of think about, as an independent contractor, it might actually be advantageous for you because, just like you said, it's a business expense, and it really carries over with you for wherever you go. And based upon your situation, it sounds like, might not be a bad thing that you have your own malpractice carrier, because it just goes with you everywhere you go, and they represent you. It's an expense that you can write off. And so to me, it's sort of a no brainer. And I think you also have to look at like, where do you license? Where do you practice? What is the statute of limitations in that state? What is the risk liability environment that you're working in? Are you working in a surgical subspecialty? Are you working in OBGYN? You're working in emergency medicine? Are you working in some of these higher risk fields? I think as a 1099 contractor, I think that's great. And I think that we all should consider that, and not just in addition to W-2 work, to consider your own liability insurance, certainly as a 1099 contract.
Yeah, absolutely. It is, kind of annoying to pay a little bit more, but at the same time, I feel like the rate that I have is really good. It's through a mental health specific carrier, and I feel like they have very reasonable fees for those of us practicing in mental health too. So I'm absolutely okay with this peace of mind, and picked a really good occurrence policy, which we'll talk about shortly here too. But you touched on statute of limitations. Let's just clarify that a little bit for the listeners. Could you explain that a little bit more?
Yeah, so I applaud you because mental health is one of the lower risk fields. So you're going to probably see and I think there's going to be an explosion of PAs in this space. I think there's a great opportunity of all the opportunities out there for PAs to work as 1099 contractors or their own business. I think that's great. With statute of limitations, every state's different. And this is where we talk about sort of like the different types of policies. And this is where it's very, very helpful to sort of know what that looks like. So statute of limitations is like, how long after an event occurs, a patient may file a malpractice case against you. And that ranges from state to state. Usually on average is around 3 to 4 years. You see typically around 3 years, but I think it's important that we all sort of look at what that is within our state. And you really should tailor like what coverage you have from a malpractice. So say, for example, and I can sort of talk now about this, but say you have like a claims made policy. What is a claims made policy? So claims made policies basically covers you while that the policy is active. So if the policy becomes inactive, not covered. But as long as you are the policy is active and you're practicing within that space, then you'd be covered. And so if you leave an employer and your policy coverage for you, even though it may be active for that environment that you previously were working in, if you're not covered under that policy anymore because you now left that employer, and then you might want to say then, okay, well, then I might need to have some tail coverage. I might need to then sort of speak to that actual carrier who provided coverage for me there and say how much, go to them and say, just, look at your face sheet, call the broker there and sort of what would it cost to have tail coverage from this policy? Or, go to another carrier and get tail coverage from that policy. This is why it might be important for a lot of people to think about like per diem, to carry that per diem coverage. So that means that you sort of carry, then you can sort of maintain that tail coverage or maintain that claims made policy still, never really go off of it. But if you just leave an employer, you might want to consider that. And then you have to consider sort of like nose coverage, which is basically, purchased from a new insurance carrier, which picks up the liability for you for previous years of practice. So covers that statute of limitations where you're that window of risk. This becomes less of an issue when it comes to occurrence policies, which is what you alluded to that you have. In my opinion, occurrence policies are the better policies, are the more initially expensive policies. But usually when something's more expensive, it usually means it's higher quality, offers the better product. So really, we really think of occurrence policies like the gold standard. So if the incident happened while the policy was active, you're covered forever, regardless of when the lawsuit is eventually filed, and as long as it's filed within the statute of limitations. But even if you leave that employer, or even if you're still covered because the occurrence happened while you were covered. And so that's why I think it's very, very important. And yet again, this is why we talk about the intricacies of sort of buying additional malpractice coverage. You have to think about all these fine details to determine, do I need to buy additional coverage? Because you don't want to duplicate things if you don't have to. So
I appreciate you breaking all that information down for sure. And I really want to drive it home to the PAs that are listening that they need to get a copy of what their malpractice is so that they can look at it for themselves, not just take someone else's word for it. That other person that might be telling you, they might be HR or admin or the owner of the practice or things like that. And some of this language can be confusing for people. Even though we're all very smart and educated people, it can be confusing. So don't take someone else's word for it. Make sure that you get a copy, that you keep that copy going forward so you can reflect and look back at it. If it was emailed to your clinic email or your hospital email, make sure you forward it to your personal email so you have it on file, and learn these basic differences, especially between occurrence and claims made, so you can interpret the information and make sure that you're covered. Or if needed, try to consult and get a little bit more information if you're having a hard time with that information too.
So if I can give a little bit of a plug, if you are an AAPA member, you have access to a series of lectures that myself and my team were able to produce for the AAPA risk management modules. And we sort of talk about some of these very specific topics. So again, sort of a plug for being an AAPA member. You have access to all this information.
That sounds like a really great resource for the listeners too. And if I remember correctly, I haven't watched them yet, but if I remember correctly from looking through them, I think that they're CME, they qualify for CME too. Is that right?
Oh, yeah. Yeah. And really all risk management work that you do and educating yourself, you're going to find tremendous CME Category 1 coverage for that. So because it's all worthwhile. And there's actually CME coverage through many of the malpractice carriers. And then through your institutions, you might find a lot of opportunities for that. And then the group that I'm the president at PAs in Legal Medicine, we provide lots of CME activity regarding these topics.
Those all sound like great resources. And one other thing that I learned recently too is if you do a certain number of hours for risk management, then that CME can also help you save on your malpractice insurance cost for certain carriers. It depends on the company, but sometimes they'll even give you a further discounted rate because of that too.
Yet another plug for being an independent contractor and being in business for yourself. This is a topic that warms my soul. So I could talk all day about this. Absolutely.
Yeah, this is true. All right. Well, we have touched on a little bit about personal malpractice policies already, but I'm curious, do you feel as though we've covered everything that would be helpful for the PAs listening to know, or are there any other points that you feel like you need to drive home to consider about personal malpractice policies?
Yeah, so there are a couple other points I'd like to drive home for people, and everybody has different situations, different self-interests that that they do. But think about, like, are you going on like a mission trip? Are you doing volunteer work? Are you doing sports coverage? Are you like a medical director for a camp? What is your situation like with your employer? Like, is it a small practice, have robust coverage? Look at like what the aggregates are. Look at what the individual coverage is. Think about what your support system is within your environment that you work in. Like, do you have a great onboarding process? Do you have great support from administration, from leadership? Do you have an APC director? Think about all of those things and how that applies to your practice environment and how you may be considered at risk. And look at the situations and say, all right, maybe I should pursue my own malpractice carrier. Because I can tell you that a lot of people have done that. If you work in a high risk field, like the areas that we talked about earlier, surgical subspecialties, general surgery, emergency medicine, OBGYN, oncology, some of these are the higher risk specialties, then you really need to consider, like, why do you need broader coverage? If you're in a situation where you're any board representation, right? So you got to think about, like, separately, like, your board representation almost definitely not going to be covered by your umbrella policy at your institution. So if you have there are some crazy patients out there who might contact your board and you might have to appear before the board for your state. That's your ability to pay your bills. That is your whole professional life, everything you work so hard for, and for things that happen that are just not your fault, just because of certain situations. Having your own personal representation from your malpractice carrier would be, very, very helpful for that. I mean, they work for you. Remember that. In this era of nuclear verdicts, like if you work in some of these states like Florida, some of these states that really have high nuclear verdict situations, oftentimes I refer to my colleagues who work in Florida, it's like the wild, wild west in Florida, the way some of these statutes are written. It's really not a clinician-friendly state from a liability standpoint. I work in a very well-protected state when it comes to, like, peer review, and that sort of thing. So you have to look at your situation, and just make sure you're not a target. So yeah,
it's understandable. And honestly, I'm not very familiar with that term nuclear verdict. Could you share that a little bit? I'm sure I will understand it, but I'm not exactly sure what that means.
Yeah. So if you in this, you may see a lot of things that come across your feed. I see more just because of what I do for work. But nuclear verdicts are basically some of these cases where they're settling for like 15 million, 20 million court cases that are these very high non-economic damage cases where they go above and beyond where you're seeing some of these policies. So if you're in a situation where your system's top end of their policy coverage for the not individual, but for the institution exceeds that, that's who that falls back on you.
Wow.
And it's a potential situation where you may be targeted to then come up with that. And then you may lose your home. You may lose all of your assets. It's not fair. Some of these things that happen to us in medicine are due to operations errors, other staff, things that are completely out of our control. I can tell you, I've had so many cases come across my desk and just say the clinician's a good person. They did everything right. And yet they're being mentioned in a malpractice case, and some things happen out of your control. And sometimes the way the momentum goes with the trial or it's just, you never know. And so that's why it's really important to say like, all right, I need to be protected. Those are the ones that make the news, right? You're not going to see the ones that are going to settle for 500,000 or less. You're going to see, some of these cases. So if you just Google nuclear, malpractice verdicts, you're going to see some of these cases.
Okay. Wow. And that prompts another question that I have. So let's say someone has a 1 million, 3 million policy, and then they are in Florida, for example, where, like you said, it can be a little bit higher risk of a state to practice in. Is there some type of way to add umbrella malpractice insurance, or isn't that really a thing? Is it more personal umbrella insurance, or could you share that difference, or would they just have to try to increase their 1 million, 3 million policy that they currently have to be better protected?
Yeah. So, I mean, you may not have control over what your umbrella policy is with your W-2 employer. So that may be out of your hands, but I think you just have to look at your situation and say, maybe I need to speak to a broker, a liability insurance professional, and sort of say, what can I do to cover myself? Because you may say, for example, you're in business and you're doing aesthetic medicine, or you're doing, oncology, or you're doing some sort of surgical subspecialty. And there are some cases where I've seen where there have been catastrophic events, lifelong disability. Say, for example, you have a child who gets meningitis at a very, very young age. Patient for the rest of their lives needs care, and, I've had a recent case where that was the case. I don't know what they settled for because I'm not always privy to that situation. That you have to sort of, the liability coverage has to cover all that. So you may have to consider, like, what is the state? What are all these situations? I may have to pay up for this to make sure that I'm covered because I'm in this high risk arena until some of these statutes are changed, putting caps on these coverages, because again, a lot of this stuff is out of our control. Then it really puts a lot of us at risk. So I would just speak to a malpractice carrier and get as much information as possible, and just consider how you want to protect your assets, because all this is potential protection of your catastrophic, right?
Sure. And do you have any particular ones that you suggest PAs work with, or that you've had good experience with over the years?
Yeah, I think some of the biggest names in the industry that really have partnered with AAPA for quite some time are the CMF Insurance, the MedPro Financial Group, companies that really work with you, and they will never settle. They will never make that decision without your consent, that are really provide great coverage and have provided a discount to PAs everywhere. But there's lots of carriers. There's a doctor's company who just acquired Pro Assurance. There's Gallagher Bassett. There's, some of the smaller carriers out there. Crico, which is a huge carrier here in the Massachusetts, Harvard Teaching Hospital landscape where I work out of the region. It's a very, very large carrier. Their company called Coverus is really the company that exists for them. They have contributed to a lot of data within the industry. Some of those are like the bigger carriers out there. We make up, PAs and NPs make up over 600,000 providers within the workforce now, and they're absolutely covering us within these areas. So I would sort of maybe focus initially on some of these carriers, and sort of see what the rates would be for them. and think about like, would they cover you as an independent contractor? Because some, they might have to go to a smaller company for some of those coverages.
I appreciate you sharing that information.
Yeah,
And
absolutely.
let's transition to talking about risk management in real life, practicing as a PA. We say this term risk management, and it really is literally trying to manage your risk in being called for a malpractice lawsuit in the future. But what does it actually mean besides trying to chart what actually happened in the visit and doing your best to put in your notes what happened and your assessment and plan? What does risk management actually mean in real life?
Yeah. So try to avoid the term like defensive medicine, right? So, I think oftentimes we're sort of taught, that's the case of how we go about things. But really, risk management is just an overall strategy that exists within you as the provider, your institution that you work for. So, like the risk management service within your hospital, they're basically learned evidence-based practices that help provide safe, effective, equitable, high-quality care for patients. It's built upon the data, right? So it's built upon the evidence that there are some of the higher risk events, transitions in care, surgical cases, informed consent, doing procedures with new products or technology. And then, we start talking about AI and stuff like that as we integrating AI with some of the stuff now with robotic surgery and some of these other areas that may put us at risk, and learning these new tools that we're using for patient care. So the number one, medical errors are one of the leading causes of death, not even just from a malpractice perspective, but they're actually a leading cause of death in this country. Heart disease, cancer, all of these things. Medical errors are part of that. It really helps us to sort of look at operations. How can we improve operations? We just had a discussion in my department meeting this week about sign-outs, because sign-outs are a huge area of risk that you may have. Like if you're doing emergency medicine, critical care, hospitalist medicine, you're in private practice in the outpatient landscape. A lot of these, there's a lot of new information that's coming out there because of like the inbox management, right? Misdiagnosis of cancer, elevated PSAs or biopsy results or whatever it may be. Some of these things, these diagnostic errors they're a high risk event. So these are just strategies that we sort of work through with committee work that we have within our systems, through evidence-based, through malpractice insurance carriers and education, that work to identify these high-risk arenas and how we can combat that risk. We use the term mitigate a lot, so try to prevent that from happening.
Okay. Yeah, lots of things to think about for sure when you're practicing. And I think it's so common, especially for newer grads or PA students, to start having this fear instilled within them and always kind of thinking about, oh my goodness, is a lawsuit coming? What's going to happen? And they are so overwhelmed actually learning how to practice medicine. But then when they hear about all these things to consider, then they can start feeling like they're needing to practice defensive medicine too, and feel like they're covering their basis and all sorts of things. So I do want this discussion to absolutely give them things to think about and make sure that they're improving in certain things and continuing to improve and build skills over time. But also, the point of insurance is to help reassure you and help you to be able to be there for your patients and practice good medicine too.
Yeah, I'd like to give a little bit of plug for AI. About 40% of practices are employing AI now. And I do think that we think about sort of the two most high risk areas within our notes, for example, which are our HPIs, right? So to me, the HPI is everything, right? And ambient AI can really capture that. And I think sort of having this information in front of us is essential. And we only have the ability to write down, remember, not everything we have from a patient interaction. I think so being able to capture that is really, really important. And then we later talk about sort of being held liable for that. But but capturing as much as you can from an HPI, and then being able to sort of have colleagues after that go back to it, but also test ordering, right? We think about like such as things like open evidence, sort of the newer versions of UpToDate or clinical key AI, or even if you're using some other forms of AI, they really can help us out from reducing diagnostic errors for patients. So, and same thing with some of the inbox management that we're doing now too, because I think it really, really can help. Because it's really the highest risk for indemnity events. So we all want good outcomes for our patients. Remember, we're patients too. Our family members are patients too. And the system at the present time is not exactly working for everyone. So whatever we can do to use technology to leverage that technology and augment our clinical practice, I think is going to be key.
Sure. And I'm curious to hear your perspective on this question. So new grads, they tend to be kind of wordy in their HPIs, right? They're learning to put everything in their in PA school. And then as you start practicing, seeing lots of patients, you learn to dial back on the HPIs. And some people say like, put the minimum amount in there so that you're able to read your note in the future, understand what's going on, but not have this excessive amount of information and lots of paragraphs in there and things like that. So from a risk management perspective, Chris, how do new grads balance that where they're wanting to put detailed information in there and what is good information to protect themselves from future malpractice issues, but also cut back and learn how to be more efficient as they're charting?
Yeah. So this is where there's a conflict between coding and getting paid appropriately and actually risk, right? That there's a collision here because really ultimately HPI doesn't really count as much, right? From a coding perspective, really it's that medical decision making, that assessment and plan process and getting those key components of like in your sort of review of systems and your physical exam, et cetera. My recommendation for you is to focus on redirecting patients, focus on the task at hand, focusing on the details that matter. And I think that comes from being a PA longer. I think that comes from knowing the medicine, knowing what you're doing clinically. And I think this just takes time. It just doesn't just happen, right? Knowing the pathophysiology, knowing what you're seeing that patient for. Like if you're in, breast cancer surgery or whatever, you have to focus in on sort of what the details are that you have to ask for, what you need to focus on, and try to marry the combination of the coding and the malpractice risk. Because it will address everything that you need to do. So wording, you may not have to worry about that because you're using ambient AI now, but know that can sometimes clog that HPI a little bit and make it difficult for a colleague who's after the facts. Just, really lean on your other colleagues. And I can't stress this enough for the newer grads and the newer career PAs. Look at other notes. Look at what your colleagues are doing. Look what's most acceptable. Don't just try to recreate the wheel here. There are thousands of, close to 200,000 PAs now in practice. Lean on your onboarding. Lean on your physician colleagues. And learn from that. So I think that is the best message I can sort of deliver in that topic.
That's great information too. And besides the HPI, when you're typing out or dictating your assessment and plan too, I have heard conflicting information from experienced providers over the years. Some of them say, again, put really good, thorough information, almost think about your differentials and type that out so that the next person reading your note can think about what you were thinking in the moment. Then I have heard, again, some practicing clinicians that have practiced over several years that say, we'll just put the very bare minimum in there because if there's not a lot of information in there, then you might actually be less risk for liability and for malpractice lawsuits in the future. Curious what your thoughts are on that aspect.
I think the medical decision making is the most important. That's where the focus should be. You can have your medical decision making have the information that an HPI would have. That to me, that's really where the focus is for the malpractice environment and how you go about that decision making and explain your decision making. Make it concise. In Epic, we have this workspace area where we can jog down and then do timestamps for everything. And so to me, I think the focus needs to be more on the MDM or your assessment and plan, because that's where it's the most important. But yeah, the HPI is absolutely important, and you can see like when you look at the malpractice carriers, that's where the two areas of harm occur the most. It's from the HPI and from the diagnostic errors. Sure. The HPI really drives your decision making, right? If you're ignoring, not listening to, not collecting the right information, it will drive the rest of the visit down the wrong path. Because if you have the wrong bias, if you go into a specific encounter really too focused and not more broadly focused that you need to be, it will guide you down the wrong path. I can't tell you how many cases I reviewed where they were like so focused on the care of the patient. This is sciatica. This must be back pain. I see this all the time. and they lost the bigger picture. I've seen cases where a patient had a catastrophic arterial occlusion that they didn't think about, or they had a spinal infarct, or they had an epidural spinal abscess. They had chest pain that they didn't think about the differential diagnosis appropriately. Oh, this is a 20-year-old, they can't have a PE, or this is a 20-year-old, they can't have chest pain from a cardiac etiology. Do not bias yourself, and think and ask the questions appropriately. Do not put yourself in that space and get in trouble, because I think a lot of PAs are put in bad spaces. And I think this happens probably more with NPs, but in bad spaces where they don't have the right onboarding and right oversight, and right training experience, where you're going to focus on things that you see the most. And sometimes people can get bogged down when they think about zebras all the time too, but that's where you can really apply that clinical experience, and just don't ever go into an encounter with an ego. It never hurts to speak to your colleague. It never hurts to speak to a collaborating physician, and AI can help us with a lot of this now, right? As long as it's reliable.
Sure.
Sort of a long-winded answer, but I apologize.
No, that's excellent information. I appreciate that for sure. And we touched on risk management for our notes and the documentation and things like that. But let's talk about those actual visits, whether they're in person or virtual, where you are communicating with the patient. How does effective and good patient communication actually help you with risk management overall?
Yeah. So communication is the number one reason why a provider will get sued. So breakdowns in communication. And one of those breakdowns in communication is like informed consent. So that's really important when you're consenting for surgery or doing a procedure. But patient notes, when you're giving discharge instructions to a patient, so making sure that you verbalize that and you have it in the documentation. This is why I think it's so important. That's why I really love the My Chart and Epic or whatever you may have, and how you distribute that information. As much as you can have things in writing as possible, because it will sort of protect you. But that's where I think it's really, really important. But and then that element of communication is key. And especially within the protected health information record, when it comes to like patient communication that exists within that space. If you're in primary care or another outpatient specialty, like all that is linked to the chart. It's all that is linked to the experience. So just making sure you have appropriate. That's why you see a lot of these triage protocols that nursing has, and decreasing that risk. It's really important that you follow these protocols and have proper communication with patients, and always have proper like a talk back that they understand it. Ask them, do you have any questions for me? What else can I answer for you? What else can I address for you? What concerns do you have? And document it, and make sure that they understand it. So those are some of the key areas. But communication is single most important thing that you can do for a patient to decrease your risk.
That makes sense for sure. Let's take a few minutes here just to walk through a case study that you have where coverage or risk management failed the clinician or PA or whoever it was for the provider at the time, and share a little bit about what you feel like went wrong, what the clinician thought was protecting them but actually wasn't, and share some information so that the listeners can really learn this in an applicable way.
Yeah. So I oftentimes, there are a couple cases that really stick out in my head that I don't know what the PA was thinking. And there are two particular cases that settled that didn't go to court. They didn't need to go to court. To me, it's biases. And I think that's where biases really come into play. You really have to think about a broad differential diagnosis. I'm going to come from my perspective, because the cases I review are in the specialties that I work in, really, that come across my desk. And so if something doesn't smell right, think broadly, speak to another provider. Don't just go down a singular pathway. So I had a case one time that involved multiple different providers, a PA in an outpatient environment, a physician in the ER, another PA in the ER, a nurse practitioner in the ER, and then eventually another ED physician. Ultimately, a 17-year-old that came in during COVID time, right? So think about sort of COVID and what it did to our thinking. Again, not to sidetrack a little bit, but the COVID laws didn't really protect us like we thought they would. And so it wasn't a ticket for us to practice bad medicine. It was only valid in certain situations. But ultimately, this patient had ataxia. She had eventual urinary incontinence. She had expressive aphasia. She had dysarthria. She had vision changes. She had dizziness. This was a second visit. Went to an urgent care, came to the ER because the mom was incredibly helpful and protective, and appropriately sniffed that there was something wrong with the disposition plan after it was called a viral syndrome. Again, you see a lot of the same thing in urgent care. Not everything's the same thing. Went to the ER. The physician appropriately did certain tests, didn't do all the appropriate tests, eventually diagnosed and dismissed the patient and said it was a viral syndrome. It was not. Patient came back 2 days later. EMS then got involved and sort of created a pathway where they said that the patient wouldn't talk, not couldn't talk, didn't have the ability to talk, but wouldn't talk. And so that then drove the pathway of this being a psychiatric problem. Ultimately, this patient couldn't walk, had severe worsening ataxia, ultimately had a catastrophic stroke that was missed because they thought it was a conversion disorder. So I will tell you, especially in someone who works in medicine, never take for granted your ability to look at a psychiatric clearance. I had a patient the other day who came in who, again, this was going down this pathway. They were here 3 months ago with the same thing. They were an older patient, right? Don't put your guard down for older patients who came in and something just didn't smell right. EMS said a certain thing, sort of similar to this case. Same thing with this nursing staff. Ultimately, I saw the patient, and the patient had a potential lethal problem with a idiopathic autoimmune, not sure, and hemolytic anemia. If I had gone down the pathway, and I know this just because, something just didn't smell right. I mean, I know this from years of experience. The patient, could have been a day or two later, could have bled out and died. Their platelet count was very, very low. And so if something doesn't smell right, if something that doesn't go the right pathway, you need to really think about that. And one last case that I had sort of alluded to earlier, this one really more directly answers your question, is about think about your delineation of privileges and what the bylaws within your department are. For example, in emergency medicine, we talk about ESI scores, which is like a severity index score with respect to the patient's presentation. Know when you're supposed to speak to a physician by your bylaws and when you don't necessarily need to speak to a physician. Know that you should always evaluate patients individually, independently, and don't be biased by what others say before you. We talked about a catastrophic event. This case just settled. Patient was, I think, like close to 2 years old, was having what was thought to be a viral syndrome again, had a fever, was lethargic, not walking, was walking, talking, doing everything before. They had negative viral testing. They called it a viral syndrome. Patient met severe sepsis criteria. They ignored it. They actually had AI markers within the Epic system that brought it up, and they ignored it. Nursing staff, provider, the PA never spoke to a physician. The patient came back 3 days later, seizures, now has a permanent disability rest of her life due to bacterial meningitis that they miss, has hearing loss, could barely walk, can barely eat and could barely feed themselves at 2 years old. Can you imagine that as a parent, having a thriving 2-year-old before you went in and it was missed? And there was opportunity there that was missed. So as a PA, especially us within what we do, when you think you're protected, you may not be. And so when you think about malpractice coverage in these cases, they're working for the institution here. You didn't follow your bylaws. You didn't follow your delineation of privileges. You didn't follow what the department standards are for sepsis. You're now at risk. Now the institution is going to say, well, we're going to focus on protecting ourselves, and now you went off, I don't want to say rogue, but you didn't follow things. You're going to put yourself at unnecessary risk. So,
yeah, those are very challenging cases to hear. Absolutely. And we all can miss things in medicine for sure. When you practice for decades, it's tough to get every single thing correct. And that is why there's importance of follow-up care, effective communication, sharing when the patient or their parents need to bring them back to be evaluated for worsening symptoms or anything like that too. So thank you for sharing those cases. Absolutely. I can imagine those cases for the PAs involved or other clinicians involved certainly led to stress and maybe even burnout for them, impacted their career. What types of things do you see impact those things based on those cases when they don't go necessarily in the favor of the clinician?
So I know this because I went through this, right? Like I myself went through this process. I see other clinicians go through this process, and it's terrible. Absolutely. You can have feelings of exhaustion, depersonalization. You can have personal self-efficacy. You can go through periods of desperation. You can have anger outbursts. You can be cynical. I see a lot of my colleagues have really become quite cynical. They can become disruptive to the overall culture within the environment that you work in. They can internalize it so much and just have sort of poor negative attitudes. They can try to combat it by not thinking about it, by overworking, which is not the solution, right? They can be less productive. They can have less efficacy in what they're doing. So all of this can this will burn us out. This is one of many things that can burn us out in medicine, right? But this in itself can lead to, really everything you've worked for, right? Everything you've done to get to this point. Think about all the years and expenses we paid. And, these are things that can happen to us. And we have to think about sort of, how do we combat that? How do we approach it? What is our mindset? Because it can't let it take us over.
Absolutely. And if any of the PAs listening are kind of feeling a little bit uneasy about their coverage, and again, don't know what type of malpractice they have or what type of policy they have in place, what are the first few steps that they should take today or in the next few days to come to look into those things? What type of documents should they keep copies of? Any red flags that they should be looking out for when it comes to policies or even contracts? What do you suggest for them of what they can do now?
Yeah. So first things first, we alluded to this earlier, get your face sheet, right? So look at your face sheet, look what your coverage is, sort of take a step back, look at your environment. Is it a claims made policy? Is it an occurrence policy? Where do you see yourself going in the next 6 months to a year, 2 years, that sort of thing? Look at what state that you practice in. Look at your delineation of privileges. Are you going to be credentialed to do something more? Are you going to be now credentialed to be doing robotic surgery, or you're going to be doing bone marrow aspirations? Or are you going to be doing interventional radiology and doing more? You're adding more to your plate of procedures that you're doing, for example. Are you in behavioral health? Are you prescribing medications that may not necessarily be FDA approved for certain circumstances, or a newer medication came in the market, or if there's a black box warning on a medication? You need to think about your circumstances that are specific to you. What is your environment that you're in, and how you support it? And sort of think about that in your own because I think of yourself as your own personal enterprise. You're the person that's going to look out for yourself, and you only. And then the people that you surround yourself that are part of your inner circle, your CPA, your financial advisor, your a broker that's going to work with you. Think about all these entities that are really going to play into your decision making. Your partner, of course, and just think about how we're going to use that to protect us and protect our portfolio, protect our assets, and to prevent any catastrophic events. So I would say those are the major factors that how I would approach it, and get copies of everything.
And keep track of those copies going forward.
Yeah. And look at your contract, right? Look at your contract. When we think about what within that contract, again, we talk about delineation of privileges, bylaws, state laws, all of these things, what within these contracts puts us at risk. Look at that may be a red flag within an employment contract that you might have that might put you at increased risk. Say if would you get, termination without cause or termination for cause? How would that play into your risk within that practice? And what is cause, right? That could be up to interpretation, right? So look at sort of the laws within your state when it comes to employment. You might need to have an employment attorney as you look at a contract, and understand, if you're an independent contractor, what does that look like from we talked about this earlier, a sensible agency. So look at the indemnification clauses that exist within your contract and what you might put yourself at risk for. And do you need tail coverage? Do you need nose coverage? All those things.
I so much appreciate all of your time and expertise and information that you shared for today, Chris. I'm curious, for education and resources for PAs listening, what is coming next for them that they could reach out to you or learn from you from?
Yeah, absolutely. So I'm someone who wears many hats. So I'm someone who, you can reach out to me if you have any questions or concerns and try to guide you in the right direction. The hats that I wear, I'm in the president of PAs in legal medicine. So we do a lot of work within this space there. So it is, the cost of membership is nothing when it compares to a lot of these things that we talked about today. So being a part of our group is I think, essential for all PAs. There's no constituent organization, in my opinion, that transcends all of our practice, everything that we do, when it comes to medical legal medicine. So it applies to everything that we do. So to me, it's worth that. My work as an educator. So I'm an adjunct and a professor when it comes to healthcare law, advocacy, and policy. So if you're interested in getting your doctorate degree or you're in that space, it doesn't have to be me doing any doctorate program, but those are areas for which I play a part in. I do consulting work, right? So I do a lot of work myself as an expert witness and consultant, but I'm also, because I've had a lot of people reach out to me about this type of work, and so I'm creating a masterclass. I'm in the process of finishing it that will sort of help guide others. So, say you want to become an expert, say you've been doing, work for 10 years in behavioral health or interventional radiology or whatever it may be, and you want to become an expert. Well, you've done it long enough that I can tell you that you can become an expert, because there are cases that exist out there, and it's a great side hustle. This type of work is so flexible. You can do it with very minimal overhead. I've been able to drive this type of work to over 6 figures, and I do it in a very balanced, very directed way. And through my course, I can teach you how to do that. But there's a lot of intricacies of doing this type of work. And we talked about sort of wellness and the importance of wellness and burnout in medicine. I really think it's important for us as PAs in this landscape that we work in to have balance. To have balance in our professional lives, to have balance in our personal lives. And I do think having the balance between maybe doing something clinically, maybe not working full time anymore, but maybe working 3/4 time or half time, and then doing something maybe different, something maybe outside of medicine, maybe something as a side hustle like this. It gives you some more financial flexibility. It improves your clinical work, and it drives down burnout and improves wellness. So I think these are things that you need to consider. So within that course that I'm offering, there's going to be work from CPAs, financial advisors, discussing all these different areas. But my advice to people is look at your niche, what you're interested in. It doesn't have to be medical legal medicine. It could be educational consulting. Done a lot of teaching. Doesn't matter what it is. I can show you sort of how you get there. It's not as hard as you think. If I can do it, especially for someone who's a full-time working provider, who's run a business, whose wife works in medicine, who is president of an organization on the board of directors, who teaches and has 3 kids, if I can do it, you can do it.
That's so exciting that you are sharing all this information and packaging up to people who are wanting to learn more and learn how they can have a lucrative side hustle in addition to their PA career if they're interested in that too. So I'm really excited for you and looking forward to those that are listening to connect with you if they're interested. I will make sure to include information in the show notes for today, like your social media links, your email, website, those types of things. But if anyone does want to reach out to you, what's the best way for them to connect with you and ask questions or learn more about your masterclass coming out?
Yeah, so the best way to learn more about my masterclass is just go right to my website, and you can also go on my social media stuff, because I do some postings on there. But the apcconsultant.com is pretty easy. APC, so it's Advanced Practice Clinician. I didn't necessarily, when I created my work, I didn't want to necessarily just focus on PAs, because I believe that we all work together. And I believe it's important that we all acknowledge that we work together, and the importance of working together. I want to be I want to be inclusive of all. And then you can go to my social media on LinkedIn, Instagram, Facebook, the APC Consultant. You'll find it there. And then my other venture eventually is again, we talked about that niche for people, and I think it's really important. And first of all, I love what you're doing when it comes to behavioral health. I think this is such a important area, and I can't stress this enough. When I presented on entrepreneurship at the APA this year, I think behavioral health is the most exploding area of medicine that PAs should be involved in right now. I do emergency medicine. I see it all the time. Patients need it. And so say you want to explore your own telemedicine company, or you want to explore your own brick and mortar place. There's no real like central ground of how to build your own practice from a regulatory standpoint, from a financial standpoint. How do you get funding for it? How do you have an EMR for it? How you develop financial resources for it? How do you liability insurance for it? All those things. How do you read a P&L sheet? I believe that sort of the next stage for PAs and how we disrupt the healthcare system, because it's not working for patients and for providers alike, is we think about our niches, think about what's important to us, think about where we can prosper in our professional lives, and is to be entrepreneurs and to have our own practices, because that's where we're getting back to why we went into medicine to begin with, to serve patients, right? And that's the most powerful message I can deliver to others is it's pretty cool to be an entrepreneur. It's pretty cool to make your own hours. Pretty cool to have a flexible environment. I'm sitting here right now in an office that I'm renting because I'm an entrepreneur, and I'm able to sort of create this life for myself that I didn't know existed before I was able to take the plunge. So I would encourage others to sort of think about what's important to them, and think about living the life you want to live and how you do that.
Absolutely. It's so important to think about what you want for your life and design your life to take one step further towards that direction as well. And for a lot of PAs, it can be entrepreneurship or other areas too. And sometimes that's outside of medicine. There are lots of opportunities within medicine, but sometimes it's outside of medicine or even a combination too. So don't feel like you are stuck in doing exactly what you're doing for decades and decades to come.
Yeah. And one last parting words, if you don't mind. I've been asked this before. What is one single thing that a clinician can do to decrease their malpractice risk? I will tell you this, and I will say this over and over again. Be kind, be professional, be patient, be courteous, be the provider that you would want to take care of your family member. Even if an error happened, there's evidence all over. They're less likely to sue you if you're able to do all that, because you showed that you cared. Mm-hmm. You showed that you put the extra time in. You showed that you were empathetic, that you're compassionate to what's going on. Sometimes things happen outside of our control. Sometimes we're human. We make a mistake. But patients appreciate that. And especially with some of these apology laws that exist in many different states, sometimes patients don't necessarily want money, some sort of big, payout. They sometimes just want people to say, I'm sorry, or they want the errors to be corrected or the operations to be corrected. So if you're kind, you're courteous, you do all these things, it goes a long way.
That's great advice. It can feel so tempting to feel like you're in such a rush, feel like you already told them what the plan is and you need to hurry on up to the next patient, right? But it is so important that you remember what it's like to be a patient yourself. Remember that they're there because they're not feeling well. They might be sick or scared, and to be empathetic and caring towards them. And I really like the quote. I believe it was Teddy Roosevelt that said, people don't care how much you know until they know how much you care. So that is absolutely important that you go into each visit with that empathetic and caring attitude, and it can help you over the long term too.
Absolutely. Again, focus on your longevity.
Yeah. All right, Chris. Well, I so very much appreciate all of this information about malpractice and risk management, and you being so generous with your time and knowledge today. Thank you so much for joining me for today's show.
Yeah, thank you for having me.
Thank you for tuning in, and I hope that you decide to continue to join me along this journey of becoming a PA the FI way. Please take a moment to press the subscribe button on the platform that you are listening to this on, but more importantly, consider sharing with another current or future PA that could benefit from the information that we reviewed in this episode. Take care and have a great rest of your day. Until next time.